the woman. Inarguably the most complex and wonderful being on earth. Graceful and yet determined and resilient. Grace, with the amazing ability to form life within her, brings into the world a gift to the joy of many. While the process through pregnancy and childbirth may look simple and spontaneous, it's not a giving, and certainly a period of prolonged waxing and waning distress. The experience ends in unpredictable outcome that ranges from healthy mother or baby, life-threatening to mother and or baby, and even fatality. Conditions associated with high blood pressure during pregnancy are among the leading causes of life-threatening and or fatal outcomes for the mothers and their babies. Hypertensive disorders of pregnancy, HDP, are those conditions causing high blood pressure during pregnancy and are among the 3 leading causes of maternal mortality and morbidity worldwide, including Ghana, where it is implicated in 15% of pregnancy-associated deaths. And that contributes substantially to the maternal mortality ratio of 308 out of every 100,000 lives birthed in the country. Preeclampsia is the severest form of HDP that, in addition to the presence of high blood pressure, is characterized by symptoms or signs of damage to another organ system, most often the liver and kidneys. Preeclampsia is diagnosed when blood pressure rises and evidence of other systems damage occurs after 20 weeks of pregnancy. If undetected or left untreated, preeclampsia can lead to serious, even fatal complications for both the mother and the baby. Although signs and symptoms associated with preeclampsia can be controlled to ensure the safety of the mother and the baby, the definitive treatment for preeclampsia is the ultimate delivery of the baby and the placenta. If a woman is diagnosed of preeclampsia at a gestational age that is too early for the baby's survival if delivered, and that's less than 34 weeks of gestation, the maternity care provider and the woman work together to decide the best way to manage the pregnancy in a way that optimizes the outcomes for both the mother and the baby. This often requires close monitoring and prompt intervention when the need arises. Some of the hallmark signs and symptoms of preeclampsia are high blood pressure, excess protein in your urine, that's proteinuria, or additional signs of kidney problems, severe headaches, changes in vision, including temporal loss of vision, blurred vision or light sensitivity, upper abdominal pain, usually under your ribs on the right side, nausea or vomiting, and decreased urine output. Meet Ajua, Hannah, Araba, and Philippa, the brave women, ambassadors of preeclampsia, who have decided to share their stories with the world to impact, inform, and encourage all women dealing with preeclampsia, knowingly or unknowingly.
I'm 35 years of age. I'm a businesswoman. I have 3 lovely children, 2 girls and a boy. And I'm a survivor of preeclampsia.
I'm 32 years old and I work with Electricity Company of Ghana as a customer service executive. I am 36 years old. I'm a geologist and I work with a multinational oil service company.
I'm 33 years old. I stay at Asamankese. I'm a midwife. I just completed a TBA midwifery college. I'm married. I have 2 sons, and then I was working at first as a community health nurse for 10 years now before I went to school.
In terms of my health, I've always been prone to high blood pressure due to family history. Both parents are hypertensive. And I remember seeing in my folder when I went to see my doctor in one of the hospitals, premium hospitals, he wrote, the first time I saw him, he wrote prone to preeclampsia. At the time I was trying to see him for fertility issues.
I normally say that I have very healthy pregnancies. because I'm not the type who throw up. I don't do anything until my delivery time when my BP goes high.
I experienced preeclampsia in 2018. I think during my first pregnancy. It was a very joyful journey to know that after 5 years of being pregnant, I think I was so excited. Then eventually, I started feeling nausea, vomiting. Even when I brushed my teeth, I'll throw up. I vomited throughout to somewhere around the 5th month.
I got married in 2015, August, and I was pregnant in October. I was very happy because it's not everybody that gets that opportunity, like getting married and then getting pregnant, like not quite long. So we were at work. I was always going to work. Everything was okay.
So for the first child, my BP was high at 40 weeks. The second one, it was at 38 weeks. After the second one, 2 years after, I got pregnant again. And it was the normal healthy pregnancy. I wasn't sick, nothing.
Then I got to know the gender. I started making my necessary preparation. I went to work one day, feeling all tired. I could see, I think everything was so dark. I started feeling some red lightings in the air. I couldn't really figure out people's faces. I had been having issues with getting pregnant, and then I had a case of hormonal imbalances, which was causing polycystic ovaries, and then later it was diagnosed to be endometriosis. So all of this had me having a very interesting history with getting pregnant, and eventually I did get pregnant. I had about 3 losses before my firstborn. With my firstborn, my doctor was monitoring me closely because of all the hormonal issues, the previous losses, and then the fact that I was also prone to high blood pressure. And so for most of the time, I was on medication throughout, and I was really being monitored closely. So with my first child, I was very lucky not to get into the preeclampsia. I was able to carry my baby to term. I had my baby, I think, at 39 weeks or so, and he's fine.
I was okay, unless I get stressed up, then I have migraines. But I was okay. There was nothing like, I didn't have any disease. So when I was 7 months pregnant, I realized that anytime I was going to work, even before I wake up, I'm already tired. I have headaches, and after taking para, it doesn't even go, it gets worse. Community health nurses had a strike during that time. So I decided to come home to my husband. We were staying at different locations.
But at some point of the pregnancy, around 27 weeks, I was sleeping one day and I realized that I wasn't well. So we went to one hospital and the nurse checked and said, "Oh, you're okay. You just need to have some rest." We met the doctor and the nurse, they checked again. I saw that it was high, but they still insisted I needed to rest.
I got to the hospital, a polyclinic. When I got there, they attended to me. They didn't really say anything much. They gave me some fluids and referred me to the main hospital, which was Kolibu. I think they told me my blood pressure was a bit high. That's all they told me. And they told me, "Oh, you'll be fine." And it was normal because of stress and from work and everything. Now, with my second pregnancy, that was sometime in 2021. It was going pretty well. And then sometime in July, I got COVID. So that kind of threw me off balance. I hadn't really been eating very well because I just didn't have appetite. And I was around 29 weeks or so at the time I was pregnant with COVID. I did have a few moments where I was quite sick, but thankfully I didn't need hospitalization. When I went to the hospital in 31 weeks for my routine check and I saw my doctor, I went for my scan, growth scan. My doctor was a little bit, his face changed Well, not so bad, but he felt like, okay, baby is a little bit smaller than his expected size at that time.
I went to the hospital. The midwife asked me, do I have any history of hypertension? I said no. And then she checked my urine, and then she realized that it was 4 pluses. So immediately she told me that, have I heard of preeclampsia? I said, I know the name, but I've not really researched into it. So she said, you go on admission. She called the doctor. The doctor said, I have to go on admission because the urine itself was bloody. So it was like I stayed in the hospital for 2 weeks. They tried every possible best. I was put on antihypertensives and then strict bed rest. So I stayed there for 2 weeks and then they discharged me back home. So I was going there every 2 days. I was put on daily BP checks, like morning and evenings. The next day I'll go to the hospital, I check my urine. So the doctor realized that the proteins in the urine were not going down. So he said, okay, you are 37. Let's monitor you till 38 and then we'll do a cesarean section.
Because I wasn't feeling so well and everything was like a surprise to me, I started checking things around me. And then I realized that I had foamy urine. So I started reading about it. Then at 32 weeks, I was going for my normal antenatal. They were checking my vitals and one nurse checked and I saw that she had gone to call an older nurse to come check my file. So she comes and says, Madam, there's an emergency. Do you have a blood vision? I said no. Do you feel weak? I said no. And then she said, you need to see a doctor. There's an emergency. Your BP is too high. So we go to see a doctor. And that's when she told me, we would have to detain you. But I still told her, I am not feeling anything. And she said, well, what is happening to you? Until your baby is out, your BP is not going down. So I started asking her, would my baby survive? My baby survived. She said yes. She had her daughter at 27 and she's still there, so I'll be fine.
It never occurred to me that at 28 weeks I'll be admitted in the hospital all the way to 32 weeks. On the 30th week, I wasn't really feeling my baby. So they rushed me to labor ward to do a scan. The doctor was so rude. I was so sad seeing other people come to the ward, have their children, and go home. And you are just being kept there with no reason. And it wasn't very comfortable. He ran the test and he checked, and by then, my protein was now plus. So he said, you know what, Nidra, I'm going to admit you. And I'm like, what? Well, as it stands, I was there and then we started drinking a lot of water. They gave me the, there's this shots, steroid shots. My doctor told me to prepare the baby's lungs in case they needed to take the baby out early. At about 4 or 5 days into my stay into the hospital, my vitals started improving. So my doctor said if he keeps on that tangent, then he was going to discharge me.
It was like I was not well again. I was not fit. So I was admitted on Thursday. So the Friday dawn, I started having epigastric pain. So he came and then I complained of epigastric pains and then immediately they prepared me for emergency cesarean section. And that was how I got my firstborn.
Nobody told me about preeclampsia. So I was admitted on Thursday. Friday, the doctor comes and says, one doctor comes and says, if your BP goes down, you're going home. So somehow I became excited. The nurse comes and says, Madam, what are you thinking about? Just relax, your BP would have to go down so that you go home, you're fine. Until Sunday dawn, a doctor comes in around 1 a.m. and asks, where is the lady with the severe preeclampsia? And the nurse pointed at me, so that's when I realized what was actually wrong with me. And so on Wednesday dawn, I was wheeled to the theater and I was delivered of my baby. And she was the most beautiful thing I could see. She was very tiny at the time, but she was so cute. All the doctors and nurses there were happy to see her. And they told me I shouldn't worry because she was older than they thought. She looks older than they thought. And so she wouldn't be in the NICU for a long time. And the doctors and the nurses at Rage NICU was also very good to us. My daughter was given a special care. And so she stayed in the incubator, I think, for 2 days. The third day we went, I was so scared, I didn't see her in the incubator. The doctor said, oh, don't worry, she's here. We are checking to see if she could survive the environment. And then on Monday, I go there to breastfeed her, and the doctor tells me she's going to be discharged because she's okay.
When I went back to school, I realized I was not feeling well. I checked and I was pregnant. Again, I told my husband. He was happy because he wanted to have another child. But I was like, I'm scared. What if I have the condition again? Because I'm in school. I have to rest. And you know, school and pressure, running up and down. So I really took good care of myself. I didn't stress myself. So I was 34 weeks, and then we came home. So when we came home, the next week I went to the antenatal clinic, and then it happened again. I started having the BPs, and then this time around there was edema too, but it wasn't severe. So the doctor told me, look, you know what's happening to you already, so you have to really help yourself while we also help you. The midwives were very caring. They would call me. The gynae told me that signs and symptoms, that when you get it, it means that you are going into eclampsia. That's the fits. So he told me that when you are experiencing those signs, just call me, and then we'll rush and then know what to do. So when I was 37, he said the way things are going, he's scared I'll go into eclampsia. So 37 weeks, they did another cesarean session for me, and then I had my second baby.
So I was in high spirits. I was good. I was eating. I know, very excited. And then here comes my doctor on the 26th of September in the around 11, looking all nice and white and with my folder. So I expected that, oh, here comes the moment where I get to go home and go and relax. And then he starts telling me the history, and I'm like, in my head, I'm like, why is he telling my history? I know everything. I've been reading. I understand everything. And then he goes like, so after looking at this, your vitals were improving, your protein went down, but then we saw a reverse trend. I'm like, okay, it's going back up. Now we are on 2+ or +2. And my face started changing at this point. So we are coming to take baby out. I was like, what?
Hourly checking of your blood pressure. The nurses were not doing it, so I was doing it myself. I hourly checked, and I was checking my fetal movements of the baby at some point. But I did what I can. But I think it didn't really last well till 32 weeks when the doctor said, oh, I've been able to carry on to 32 weeks. So they were going to do a CS for me. The nurse came to take the fetal heartbeat, which was like, they told me it was good. They didn't really mention to me, but they told me it was fine. I went downstairs to do a normal scan to check the heartbeat of the baby. Just checking the heartbeat of the baby, they told me they couldn't feel anything. They made me chew ice blocks because they believe it will keep the baby kicking. I chewed a whole pack of sachet water block. Nothing happened. I didn't believe the scan they told me that the baby was lost. I went all the way to Kolebu, the main, I think the radiotherapy area, to go and do the scan. I didn't still believe it. And I went to those Kolebu scans. I don't know which one, but I just entered and just went to do another scan, and they said the same thing. I told them my baby wasn't dead. So throughout that time, that morning to the evening, I still didn't believe that at 32 weeks I could just lose the baby, whilst in the morning I could feel this baby moving so strong. I took it normal. I told them whatever they are saying, I don't trust it. they told me they were going to induce me. I believe them. After all, 32 weeks, if I'm being induced and my baby is alive, I believe he'll go to NICU and everything will be fine. I was induced, the induction was so painful. So I was able to proceed all the way to I think they said I was dilated for 2 centimeters and everything was set, and they took me to labor room. Eventually, I pushed my baby out. I saw the baby, everything, and I don't know, at that instant, I didn't feel anything. I still believed my child was alive. So they took me to the, I think, recovery. I recovered, went back to my ward. I still believed my baby was fine. So the next day, that was when it hit me. I cried. I cried my eyes out. I just couldn't believe. I was like, oh God, for 5 years, you blessed me with one and you just take it out of my hands just like that. Sorry about that, but I still have some hard time whenever I talk about it. So I told myself I would never ever get pregnant.
At 2 p.m., they started preparing me for theater. And that was how I got into theater at 4, and the baby was brought out. Now, my baby was 1.97 at birth. And frankly speaking, I was quite a bit depressed. I would say depressed is the word, because when I looked at him, he looked so small when I compared him with my first child. But then he gave a very loud cry that gave me a little bit more confidence that, okay, this baby is fine. He was put in the incubator for 1 day because they just wanted to, exercise some caution. Even though he was looking fine and everything was fine, they decided to keep him at least 1 day in the incubator. And then after then, he was discharged.
But the sad thing is that, they never tell you what was happening. I had to read through the Google, and Google doesn't give you all the right answers. So I think one of the times, I just went to one of the nurses' room and I saw the charts about high blood pressure, preeclampsia, eclampsia, and what happens. So that was when I realized that I was suffering from preeclampsia. So I started Googling it and everything. And they told me, I think what they said is, I think it's mostly US. It's mostly managed. So I still had faith my child wouldn't die. But anyway, the unfortunate happened. But God being so good, and through help of family, friends, I even neglected God. I could go to church, whatever I was preaching, I was like, blah, 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 whatever they say. They have said it, yes. God is in control, God. I don't see that in my life. So it took some time with my husband. He had to be praying whenever, sometimes I wake up at dawn, telling him I could feel my baby crying. And he will be like, crying from where you never heard the baby's sound. For 6 months, I never held a baby. If I see a pregnant woman or a baby, if the child is below 6 months or like a baby, fresh baby, I was really, really sad. I just didn't want to hold a baby by then because I think I was going through a lot. He requested for me to go and see a psychologist and somebody to talk to, but I refused. I didn't know, so he was doing it with me at home. Eventually, I think I became fine with it and said, okay, let me give it another try. So we did all the necessary labs. They told me everything is fine. Fortunately, I had to go and meet the same doctor. And we did our routines and everything. And lo and behold, during COVID, I conceived again. So this time around, knowing all the high dangers and everything, I took all the necessary precautions. At 34 weeks, I think that particular day, it was Christmas. It was around Christmas. I told him, after the check, he was like, your BP is high, you go to emergency. They gave me some fleas. I was like, oh, doctor, am I going home? He said, no, we are taking baby out. I said, oh, no, why? So eventually I had to call all my family relations to tell them that's okay. So this is the ordeal. I'm going for emergency CS because my pressure. Everyone was like, oh, that's nice, that's good. Within 15 minutes, baby was out. Baby was crying healthy, but baby was small, 2.3. They told me because of preeclampsia, so the rate of baby's growth was a little low. So they took baby to NICU. My husband went to NICU. The time my husband got there, baby was brought back to labor room because they said baby is fine.
Now, in terms of this hypertensive disorder or preeclampsia, it's something that even our eating habits as Ghanaians, I mean, there's Kobe, there's momoni, there's everything, there's so much salt, there's a lot of issues, and all of that, these are things that have a way of making your health go from bad to worse. But a lot of times, people out there don't even know the impact of what they are doing. A lot of us don't exercise, a lot of us don't eat well, a lot of us don't do some very basic things that will help us. Now, if there's a lot more education out there, especially for those like that are not very educated, you know, doing it in our local dialects, the doctors giving more information out there, aside from those of us who like to read and even call our colleagues or our friends who are doctors and nurses to ask questions, it would really help.
If I just go and they tell you a +1, you never understand them. A +2, a +4, you don't understand them. But if we are being educated during this antenatal, if the doctors are given much more time to spend with the patients, that is the pregnant women in antenatal times, I'm sure a lot of these things and discussions will be well managed.
Somehow I feel that if an education is given to pregnant women, to people who want to become pregnant, we could avoid some of these things, because I had 2 children already and I had never heard anything about preeclampsia.
As a patient organization whose founding was inspired by a 4-time survivor of HDP, Apec Ghana endeavors to educate, inform, and advise the public, especially pregnant women, about the prevalence, nature, and risk of hypertensive disorders of pregnancy, notably preeclampsia, eclampsia, and HELP syndrome. Campaign for greater awareness, action, and research into improved methods of detection and treatment, and provide support to people and families affected by preeclampsia to prevent and ease the physical and emotional suffering they experience. Apec Ghana, saving precious lives.